Hi, I wanted to talk about autoimmune disease and in particular vasculitis, and in particular Wegener's vasculitis, also known as GPA. I do have GPA. I am more fortunate than a lot of people because mine has remained in my sinuses and not traveled to my lungs or kidneys. For those who are new to vasculitis, it's an inflammation of the blood vessels. And with the inflammation of the blood vessels, it cuts off the blood supply to major organs, such as with your lungs or your kidneys. Mine and my sinuses, it's kind of hard for me to talk about because it's not something that people necessarily want to hear about. But I think vasculitis in itself, because there's so many different kinds, needs to be talked about. It needs to be out there, and a lot of people do not talk about it. Other diseases are in the forefront, and that's great. I'm really glad. But I think vasculitis needs to be more in the forefront because there are a lot of people that are suffering from it. I started out at a young age with mixed connective tissue disease in my late 20s, and that is, of course, your immune system attacks itself for whatever reason. And I had offshoots, or I would say symptoms of different major connective tissue diseases such as lupus, scleroderma, rheumatoid arthritis, etc. And I would get symptoms of those off and on throughout the years. Manageable a lot of times by prednisone. There was a time when I was so short of breath I couldn't walk well and far. And they put me on prednisone for 3 months. So these were the kind of things I went through. One time I had huge purple spots all over my arms. And then it would subside for a few months or a year or so, and then something else would crop up. But during all this time, I worked. I rarely took time off, no matter how I felt. So moving past that, about 6 years ago, when my stomach went crazy, I decided I needed to also go to a rheumatologist. I had not been back to one for years, and that was mainly because my symptoms could be controlled by my primary care physician. But now I was in a situation where not only was I gluten and dairy intolerant all of a sudden, but I just had a feeling something else was going on. So I went to a rheumatologist. She's a wonderful, wonderful rheumatologist. And at first she thought I had a giant cell, it's called giant cell vasculitis, because there was a spot on my aorta, which we found out later was the beginning of a clogged blood vessel in my stomach. But you can't usually they take a sample or a biopsy, and you can't take a biopsy in the aorta, obviously. My blood count, my sedimentation rate, they call it, they look for that, C-reactive protein. These, I know, if you're not used to them, they probably don't mean a lot, and to be honest with you, I don't know the ins and outs of all the blood tests. I wish I did. But I know that they show the inflammation within your body. So my rheumatologist decided to dig further into my blood work. For one reason, when she first saw me, she noticed that my nose was slightly caved in. I don't know if you can see it from this angle or not, but there's a slight cave there. And I myself had noticed it several years before, and thought, my nose was always straight. There was no dip in it, but I kind of sloughed it off. She did further blood tests and what they call your ANCA count, which you can't always depend on, but is a good indication. Your ANCA and your count in your blood, along with your sedimentation rate and C-reactive protein, but specifically the ANCA will tell about the Wegener's or GPA vasculitis, and mine came out positive. I have to backtrack here because for years and years I had sinus infections, and that is one of the indications of Wegener's or GPA vasculitis. I was on antibiotics a lot, and in the last few years before I was diagnosed, it was like I constantly had a sinus infection, but in actuality, what had happened was, and I didn't know it, I had a lot of pain, but the inflammation of my blood vessels in my sinuses had cut off the supply of blood to my septum, and my septum was gone. I can almost pinpoint the time that happened. It was a long, long time ago. But something, when I had a sinus infection, and I don't mean to be gross, I blew my nose and something came out that to this day now I think was part of my septum. Because I am missing my septum, I do have to go to the ENT every month to be cleaned out. Because really I don't have any sinus. It's just one big cavity now. I suffer from facial pain, ear pain, jaw pain, because I also have TMJ, which I do or do not know if it's caused by the vasculitis. Nobody's really certain. But, and I'm constantly, my nose is constantly stuffed. Sometimes I can't smell. Sometimes I can. So, it's just really tough. It's been tough for several years. And I have to really thank my ENT too, because he is just marvelous for taking care of me every single month. We've become like a family at his office. I've been blessed with good doctors. But my point, I think, also is that not everybody with chronic sinusitis has vasculitis, but it's a question you should ask yourself, because I think in the hubbub and patients in and out and everything else, it's not something that, a doctor may zero in on. She's a person, some people just have chronic sinusitis, and that's that. Unfortunately, I went for quite a few years without being diagnosed, and a lot of it's my fault for not going back to the rheumatologist. I wish that I had, but it is what it is, and I try to live with it the best I can. I do get night sweats. Sometimes that's from my stomach too. I do get, as I said, facial pain, and I do get fatigued a lot of times. Some days I have tremendous energy, and some days I just have none. So it all depends. To complicate the situation, because my stomach went bad, and at that time, when it went bad, I also, as I mentioned in previous videos, I could no longer take a lot of medications, antibiotics that I took before. And this included medicine that would help the inflammation in my body. I do have quite a bit of it. So we started out with injections, which I wasn't really good at, but I learned. And my inflammation went down because if I took a pill, I would get horribly sick. So instead, we went to injections. Then I tried a couple of different pills just to see. I didn't last long on them because I would get horribly sick again. I mean, it would be like spending every day in bed. Then we went back to a different injection once we found out that I had GPA, and that was methotrexate. And I took that for a while, and I did okay for it for a while, but then all of a sudden, my stomach started acting up, my GERD started acting up, and I was just sick a lot of the time. Really more than people know. It's a strain, but I have to live with it. Right now, we keep our fingers crossed, the rheumatologist and I, that it will not travel to my lungs or kidneys. That'll stay where it is, although it's done extreme damage. And hopefully, I take a low dose of prednisone as much as I can, just to keep some things at bay. But I know my blood tests that came back the other day, part of them are not good. So I'm keeping my fingers crossed that things will get better. But I'm also keeping my fingers crossed for everybody out there that has it so much worse than I do. I hope that this helps some people that have vasculitis. And I hope that you share it, not for my benefit, but for other people, because I want people to realize that vasculitis is a horrible disease. And really, you can go into remission, but I don't know how long it lasts. For a lot of people, it doesn't, and it takes a long time to get there. So it's not a curable disease as far as I know. Like I said, you can go into remission, but it's not, this is the end, you're cured now. No. So I hope that this has helped some, and I will talk more about it at a further date and keep you updated on my blood tests and how I'm doing. And as always, if you have Wegener's, GPA, or vasculitis in general, please leave comments. I'd like to know, and I think it would help the community at large that has vasculitis.